Nice to meet you all here. It has been long waiting for a face-to-face conference, and also welcome for the hybrid colleagues joining us this time. So I will start our panel discussion by sharing some clinical AI initiative in the hospital authority. So perceptual and interpretive errors in diagnostic radiology is a well-known phenomenon, but I believe technology can help us to reduce some sort of this kind of errors. So failure is not an option in any innovation process. Failure and innovation are twins. We cannot avoid. However, healthcare innovation is not bearable for any failure. So we must be very cautious in any innovating and implementing any new technology in healthcare. So we need quite a number of successful factors before we can implement AI in a hospital authority. So we need to engage many stakeholders. And the most important is that how can we integrate the AI into our clinical workflow so that we can have a great improvement in our clinical care. So for the steps of building our data pipeline, we need to have our data scientists, and we make use of some public data sets as well as hospital authority data to build our model. And then we have our data labeling and then annotation. And then after the model built, we will further validate with extra data, and then we will put into our data pipeline. So imaging AI in elsewhere of the world, they are mainly implemented in departments of radiology. And also they are mainly in a separate portal, which means there is no integration with the electronic health record system used by our clinicians. So we want to have some breakthrough in HA. So we are grateful to have 45 volunteer radiologists to participate in the project. So they help us to label the image, and then we will pass to our data scientists for further model developments. So the first step is they need to define what is a chest X-ray and what is not a chest X-ray. Then they will help us to define what is a normal chest X-ray and what would be some pathology inside the chest X-ray. And then they also help us to localize the lesion and then provide to our data scientists for further training. So when the AI model detects some chest X-ray pathology, they will help us to flag us as a red indicator in our electronic health record system, which we call clinical management system. So when doctor encounter the patient during the patient care, they will notice there will be a red indicator here, and if they go through, click the AI indicator, they will quickly see that the suspicious AI detection right now in front of them. And they can direct view the image with the localization as well as the original image on top of the clinical management system. So we hope they can have a prompt management decision making upon seeing the AI results. So another chest X-ray AI that we think it is very important is the feeding tube placement. We need to make sure the feeding tube is inside the digestive system instead of inside the lung. Because the milk, when it goes to the lung instead of the digestive system, the patient will die. So this time, the labeling of the chest X-ray feeding tube is by our clinicians. So I would like to emphasize that different projects will need different stakeholders and also different friends to help us to make it happen. We need to facilitate the concept of the smart city blueprint in Hong Kong. So we established a data collaboration lab in 2019 that we would put all the 25 years data of hospital authority inside the data lab. And then we will have some collaboration with local universities. So the first project, which is a very good project, I can say, is the collaboration with two local universities with the development of the AI model for detection of fractured neck of femur. So this time, our colleagues work with the university colleagues to detect whether to label what is the prosthesis hip, what is the normal hip, and what is the fractured neck of femur X-ray. So after the labeling and the development of the model, we also apply the same pipeline. Still, the red indicator in the clinical management system. So when the patient with slip and fell, and then they attend A&E, the doctor at hand will immediately knowing that whether the patient have a very subtle fracture or already have a severe fracture, they will refer up for this kind of patient. So both the chest X-ray and the hip X-ray AI are well adopted in the 18 A&E. So besides the imaging AI, we also adopt some natural language processing for reading the pre-test lab reports. So when the AI read all the pre-test lab reports, those with abnormal results, we will check it and then auto flag in the patient's clinical management system record so that we can make use of further medication decision support. So over the last couple of years, we do develop a number of clinical AI. So it will be my pleasure to share with you most of the stories in the coming future. So I believe collaboration with different parties and different talents, we can help our healthcare system to have a sustainable future. So welcome to our data lab. If you have any brilliant idea or some initiative that you would like to try in the data lab, please come and join us. Thank you.